Hey guys!
This week's disease is pneumonia. What is pneumonia? Pneumonia is a lower respiratory tract infection that causes the air sacs of the lungs to become inflamed. Purulent material such as fluid or pus enter the air sacs, and these can cause many symptoms within a patient.
Pneumonia has many factors that can cause it, but the most common one is bacteria. The bacteria that usually causes pneumonia is Streptococcus pneumoniae, and here's a picture of that bacteria. And this is from a microscopic slide. Other factors that can cause this condition are organisms that resemble bacteria, such as Mycoplasma pneumoniae, fungi, and viruses such as coronavirus. Pneumonia can be nosocomial, which means that a person can get this disease when they're in a hospital.
Pneumonia can be mild to severe in anybody who contracts it. And the severity of this condition depends on the mode of contraction, which is how you get the disease. And people over 65 or under 2 are more likely to get a severe version of this condition. And present health or past medical history may also play a role in how severe the condition affects you. Common signs and symptoms of this condition are chest pain, when a person is coughing or breathing, altered mental awareness and confusion, a persistent cough which can produce phlegm, fatigue, sweats and chills, diarrhea, and dyspnea, which is also known as having trouble breathing.
Newborns and infants who have this condition could be asymptomatic, which means that they don't show any signs and symptoms that they have pneumonia. However, in some cases, they could have signs and symptoms, and the most common signs and symptoms in newborns and infants are vomiting, fever, cough, restlessness, fatigue, difficulties in breathing, and having a hard time eating food.
Some ways to diagnose pneumonia are physical examinations, which a doctor may find crackles in the lungs. That suggests that a person probably has pneumonia. They can do this through a stethoscope. Other tests are blood tests and sputum tests, which can find or determine the organism which causes pneumonia. Chest x-rays can help with diagnosis, and you can find where the infection is located. CT scans, pleural fluid culture, and pulse oximetry are good ways to diagnose pneumonia. They can help determine the blood oxygen levels.
The treatment options which are used to treat pneumonia can depend on a variety of factors. These can include a person's age, their health, the way they contracted pneumonia, and the severity of the condition in them. Treatment options include antibiotics, cough medications, pain relievers, and fever reducers. These treatment options can help treat bacterial pneumonia, and they can also help reduce symptoms such as a cough and fever that are present with this condition. Although cough medications and fever reducers, as well as pain relievers, won't cure pneumonia, they can help with the discomfort. There are many treatment options that a person can do at home, and this can help them recover from this condition faster and also have a less chance of having complications in the future. Some of these methods are getting enough rest, making sure to drink a lot of water and fluids to stay hydrated, and taking prescribed medications.
In some severe cases of this condition, one may need to be hospitalized. They may need to be hospitalized if they're over the age of 65, confused about time, or if they have lower kidney function, have a systolic blood pressure below 90 millimeters of mercury, have a diastolic blood pressure below 60 millimeters of mercury, have rapid breathing, have low body temperature, and an abnormal heart rate below 50 or above 100.
For children suffering from this condition, the criteria are slightly different. Kids who have this condition may need to be hospitalized if they're under the age of 2 months, they're too sleepy or lethargic, are having difficulties breathing, have low blood oxygen levels, and if they show signs of dehydration.
Some complications that may come with pneumonia are bacteremia, which is when the bacteria that cause the infection enters the bloodstream. This can cause the infection to spread through the entire body and affect the other organs as well, which can lead to possible organ failure. Other complications are having lasting difficulty with breathing, a pleural effusion, which is a buildup of fluid in the pleura, and an abscess in the pleural cavity, which is when pus is created in the cavity that holds the lungs.
Even though pneumonia can affect everyone, some groups are at a higher risk of contracting this disease. These groups are people who are under the age of 2 or over the age of 65, people who are hospitalized since pneumonia is nosocomial, people who have a chronic disease, smoking, and being immunosuppressed or having a weaker immune system.
There are various ways to prevent pneumonia. You can make sure to be vaccinated and you can have good hygiene habits, meaning washing your hands every time you return from the public and taking a shower daily. You should also avoid smoking to keep your lungs strong and maintain a strong immune system. These prevention habits will keep you healthy overall. Pneumonia is a common disease that affects more than 1 million people each year. So it is important that you are educated about it so you can take action early.
Thank you for watching.
We hope you enjoyed the video.
We also have a new update for you. Due to schoolwork and other commitments, our posting schedule has changed from weekly to once every 2 weeks. Thank you for still watching to our videos and being subscribed to our channel.
Yeah, and we may be posting each week, but it's all dependent on our schedules, but we will make sure to post at least once every 2 weeks.
Make sure to follow our Instagram for our other company, Health Kiosk. It will be in the description down below.
Make sure to give it a big thumbs up, which is also down below. Comment to our channel if you find our information interesting, and subscribe.
Also, don't forget to hit the notification bell so you know when we post new videos. Bye!